A 40-year-old schoolteacher attends his general practitioner surgery with his wife, with complaints of feeling constantly fearful and stressed. These feelings have been present on most days, over the past 3 years, and are not limited to specific situations or discrete periods. He also experiences poor concentration, irritability, tremors, palpitations, dizziness, and dry mouth. He has continued to work, but his symptoms are causing stress at work and at home. He denies any problems with his mood and reports that his energy levels are fine. He admits that he is experiencing problems with his sleep. He finds it difficult to fall asleep and states that he does not feel refreshed on waking up. He has been married for 15 years and lives with his wife and 2 sons, aged 8 and 10. His parents live locally, and he has no siblings. His father has been diagnosed with Alzheimer's dementia. He remembers his mother being anxious for much of his childhood. He has no previous medical or psychiatric history and is not taking any medication. He smokes 20 cigarettes per day and drinks alcohol socially. He has never used any illicit drugs. He tends to hide his symptoms and said that he was seeing his general practitioner because his wife wanted him to seek help. Mental state examination. He makes fleeting eye contact. He is a neatly dressed man with no evidence of self-neglect. He appears to be restless and tense, but settles down as the interview progresses. He answers all the questions appropriately, and there is no abnormality in his speech. His mood is euthymic, and he does not have any thoughts of self-harm. There is no evidence of delusions or hallucinations. He is able to recognize the impact of his symptoms on his social and occupational functioning, and is keen to seek help. Physical examination. His blood pressure is 140/90 Marchurist, and his pulse is regular and 110 beats per minute. The rest of the physical examination does not reveal any abnormality. Questions. What is the differential diagnosis? How would you investigate and manage this patient in general practice?
Let me answer your questions and formulate the patient case. This man is suffering with generalized anxiety disorder, GAD. His predominant symptom is a feeling of constant fear and insecurity. He also has symptoms of anxiety related to autonomic arousal, including tremors, palpitations, and a dry mouth. These symptoms have been present on most days for a period greater than 6 months. These symptoms are constant and not limited to specific situations like fear of being embarrassed in public, social phobia, fear of heights, specific phobia, discrete periods, panic attacks, or related to obsessions, obsessive-compulsive disorder, or to recollections of intense trauma, post-traumatic stress disorder. Let's talk about differential diagnoses. Number 1. Depression. Anxiety symptoms are common in depression, and comorbid depression is often seen with GAD. The type of symptom that appears first and is more severe is conventionally considered to be primary. Number 2. Panic disorder. There is a discrete episode of intense fear with sudden onset and a subjective need to escape. Number 3. Other anxiety disorders. They have the same core symptoms as in GAD, but the symptoms occur in specific situations as in phobic anxiety disorder, OCD, or PTSD. Number 4. Substance misuse. Symptoms of alcohol or drug withdrawal may mimic those of anxiety. Number 5. Physical illness. A host of medical conditions can mimic GAD, endocrine disorders such as hyperthyroidism or pheochromocytoma, neurological disorders such as migraine, deficiency states such as anemia or vitamin B12 deficiency, cardiac conditions such as arrhythmias and mitral valve prolapse, and metabolic conditions such as hyperglycemia and porphyria. A detailed history and mental state examination are needed to rule out the differential diagnoses listed above. Relevant blood tests like thyroid function tests, blood glucose and complete blood count are needed to rule out the physical differential. Additional tests can be done in the context of other findings on history or examination. Patients seen in early stages of GAD may respond to counseling offered in primary care. Those with moderate to severe symptoms need cognitive behavior therapy, CBT, which is the first-line treatment. Chronic or severe cases may need referral to psychiatric services, as in the case of this patient. Anxiety management provided by a community mental health nurse is often effective and no other treatment is needed. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, paroxetine, or citalopram, can be useful, but may cause paradoxical increase in agitation and reduce patients' concordance with treatment. Side effects should be monitored carefully. Benzodiazepines carry a risk of developing tolerance and dependence with continuous use and should only be used very rarely, and then for no more than 3 weeks.